to Dr. Peter Kamunyo, the CEO of NHIF, who spoke to KTN News anchor Linda Ugutu on KTN Prime.
Ensuring that the frontline workers actually have access. In a meeting that we had this morning actually, with our Cabinet Secretary of Health, Senator Mutahi Kagwe, whereby it was resolved that all healthcare workers who are admitted in government hospitals for COVID, their bills would be waived. So in terms of providing support, we are continuously working together with the Ministry of Health, ensuring that we are able to cover our frontline workers, and also providing the framework and the base for universal health coverage as we leave no one behind.
Dr. So what you're telling Kenyans this evening is that you had a meeting with the CS Health Mutahi Kagwe, and part of the resolution of that meeting is that healthcare workers who are admitted in government hospitals will not pay a single cent.
Linda, that is affirmative.
Perfect. All this week here at KTN News, we have been focusing on the crisis in the health sector, speaking with various experts and officials in the bid to shed more light on where we stand, the key issues, and hold those in authority to account. Well, we continue with that conversation here at News Desk today. And with healthcare being a shared function between the two levels of government, could this be presenting an opportunity for leaders to pass the buck? Well, I'm now joined by the Kenya Medical Association President, Dr. Were Onyino, for more on this conversation. Doctor, many thanks for joining us here on News Desk. Now, about 48% of hospitals in Kenya work under the Ministry of Health, another 41% perhaps under the private sector. Now, in the public sector, the 47 county governments deal with the service provision at the local level. The national government, on the other hand, deals with policy and referral hospitals. But that being said, where is the fundamental shortcoming between the roles of these two levels of government?
Thank you. Thank you for having me. I think that the shortcomings is in terms of the management of the human resource aspect, which as Kenya Medical Association and from the other professional associations and unions are representing the healthcare workers, we have said to be able to address this particular issue, we need to centralize so that we can have equity in terms of distribution of these healthcare workers, so that we can have functional health institutions. So the issue here is we need to have a centralizing body, which in our opinion is a Constitutional Health Service Commission, which will ensure that then we have healthcare workers equitably distributed in all the countries to be able to provide service to Mwananchi.
All right, so let's perhaps discuss that in more detail, what the Health Service Commission that doctors and medical workers have been advocating for would seek to solve. One, like you mentioned, is the geographical mismatch in available care and the need that is on the ground. So when it comes to available care, of course, we're talking about trained medical personnel. Speak to us about the situation now geographically in terms of the available healthcare needs in the country.
So geographically, if you see, most of the healthcare workers are actually distributed in urban centers. You find, for example, out of 2,000 specialist doctors that you have in this country, you find almost 1,500 of them are actually based in Nairobi, and then the rest in the major urban centers of Eldoret, Mombasa, and Kisumu. What this means is that a person who seeks help in Turkana or someone in Lunga or Isebania or in other rural areas, they do not have access to these specialized health services. So if you have a centralizing body, it will ensure that someone who's in Mandera can have an access to a surgeon or a plastic surgeon there, the same way someone who's in Nairobi have access to this. So the distribution of healthcare workers, especially the specialized healthcare workers and even the other lower counties, there are some counties in this nation that do not have any single specialist. So we need this particular kind of workers to be a national resource, where now the government, national government is able to second through a mechanism of a health service commission, so that we can have these workers being available in rural areas to provide care.
All right, and if there's anything that has highlighted the situation in the healthcare system, of course, it's the COVID-19 pandemic. We've had doctors and healthcare workers going on strike, and on one hand saying they are in talks with the government, but those talks are not fruitful. On the other hand, speaking to one level of government, but not in agreement with the other level of government. And at the end of the day, we've had a lot of corruption therein, a major challenge. How would the Health Service Commission seek to solve the issue of corruption? We've had stealing of public funds. We've had scandals at the Kenya Medical Supplies Agency as well. How would the Kenya Medical Health Service Commission rather solve this situation?
Yeah, the Health Service Commission will mainly handle the human resource aspect in the healthcare. The issues of corruption and misuse of funds that we saw in KEMSA, that needs a multi-agency approach where we have the ESCC, the Judiciary Office of the ODPP coming together and actually pursuing these culprits who are actually diverting public funds that are meant to help Wanjiku, and they are misusing it in questionable tenders. So in terms of the Health Service Commission wanting to cure is the issue of ensuring that healthcare workers are well managed all across the country to be able to provide the service that is much needed. In terms of issues of corruption, that one needs a multi-agency approach and leadership, because that is what is failing. And even the crisis you're seeing in most of our counties is because of a failure of leadership from the highest level in the Ministry of Health. And this is why you see, if you're not able to talk together with the unions and the associations and agree on the best way forward to protect your frontline healthcare workers, then you wonder what else. So I think Health Service Constitutional Health Service Commission is much needed to ensure that every Kenyan citizen has access to quality healthcare, including reproductive health.
All right. It's a commission that healthcare workers have championed for quite a while now, but there has been concern that over the years, health has not had the political priority that it needs. In consultation with both local and national government, how far are we as a country from having a health service commission?
I think we're not far off. I think we need the political will to align with the demands the healthcare workers are facing. And actually, it's not an issue about the healthcare workers, but about access to quality, affordable healthcare to each and every one inch of this country. And that is something that actually is guaranteed in our constitution. So we have presented our submissions in Parliament and in Senate. We presented it to the BBI team. And actually, everyone was in agreement in terms of the necessity of having the healthcare sector better managed. Because if you look at the Agenda 4 and the universal health cover that you want to provide, which you're celebrating this week, we really need to address the challenges that we are facing in terms of service delivery. And just one thing that I want to say is there's no way when you have a constitutional health service commission that is going to undermine the gains that you made in terms of the evolution of healthcare services to the counties. In fact, it's going to strengthen it. It's going to ensure that each and every person in the counties have the same access and the same quality of care, irrespective of the geographic location in this country.
All right, and very briefly and finally, initially the evolution of healthcare was pegged out to be the paradise for healthcare workers, the one that would sort out all the issues and the welfare issues of healthcare workers. Do you feel that this shared function between the local government and the national government does indeed provide an opportunity for leaders to pass the buck whichever way?
I think as an association, we believe that health should remain devolved. The only part that needs to be better handled is by the national government, the human resource aspect through a constitutional health service commission. And they need to be, the two levels of government have to actually coordinate better and work together harmoniously to ensure that this is done. So the national government has, as the custodian of the resources in the Ministry of Health, then can be able to actually work hand in hand with the counties to ensure that these shared functions are well delivered and they actually achieve the function that they need to.
Doctor, many thanks for your time. Dr. Were Onyino, there is the president of the Kenya Medical Association. Many thanks for your time. Now, the Kenya Conference of Catholic Bishops now says it is too early for Christians to say yes or no to